Today is the United Nations International Day Against Torture. We here at Access Social Rehab Center for Victims of Torture, we in full support of this day and support of our survivors of torture who come from many areas in the world, who've been persecuted. We rehab them, we help them, and we stand all together against torture all over the world.
The community health and research center that we serve, it is really the answer for the uninsured, the underinsured, the non-insured, and the insured. It is also the answer for any academic center, both in the state of Michigan or in the nation, to research a certain aspect of disease or diseases in the Arab American community. We are so happy to be where we are at now, but we have so many opportunities to go forward in the near future. These integrated services, they're composed from almost 57 individual programs and 35 funding sources with a budget of almost $8 million.
Cody Hussein is, he was diagnosed when he was in his mom's womb that he have Down syndrome and he have a hole in his heart.
يصلحوا له عمله للقلب علشان قالوا حق القلب مفتوح.
I just hope that they grow up healthy and they grow up to be educated children and become some of a valuable to society.
There were no rooms in any of the domestic violence shelters in a 75-mile radius that could accommodate my family because of the season. They referred me to Wayne Metro. I got emergency housing immediately, and I no longer have to worry about my housing, the roof over my head. They are very, very compassionate people. They've given me what I needed, and now all I have to do is maintain it, and that is what I'm going to do because my children deserve it. Simple as that.
Well, our program is under the Department of Mental Health and Family Counseling, and it consists of providing mental health treatment to children, adolescents, and adults. And in addition to that program, we also have a substance abuse component, which right now we are targeting adults from 18 years and older.
Our substance abuse prevention program has been around for several years now here at Access, and our primary focus is tobacco and hookah prevention, which is a form of water pipe smoking. And our program works to really educate the community and bring awareness to the realities of hookah smoking.
Access Hope House it's a day program for members who has mental illness. Members and staff, they work side by side, and we do our daily activities, such as we cook together. We do have a garden that we planted, members and staff, and we take care of it all together. We do have a snack shop where members, they sell snacks. It helps them to gain their coping skills, and they go back to their normal life to find a part-time job or full-time jobs or go back to school. So they are back to their normal life after they're suffering from mental illness.
Thousands of women in a daily basis are screened for cancer comfortably, either walking into their community health center or being transported to their community health center or actually being visited at home to be told about how to prevent cancer from their lives. We just opened a second community health center in Macomb County in order to go to the feet of our client of Macomb County, especially the refugee community.
The Access HIV and STD prevention program targets people at high risk, primarily Arab Americans with comprehensive prevention education, HIV and STD testing and treatment. There's a lot of stigma, especially in the Arab American community, about sex and sexuality, homophobia, and things like that. So everything that we do is breaking new ground in our programming and in outreach to the community. Before Access HIV program, there was nothing for LGBT Arabs, and that was one of the reasons why we had chosen to implement the Empowerment Project, because part of the Empowerment Project, it's a community level intervention. So it's targeting the social norms within a community. And in order to do that, you build a sense of community within your target population or your subgroup. So we give the young Arab guys a place where they can feel safe, where they can be themselves, where they don't have to worry about somebody finding out and outing them or whatever. And throughout the activities that we do is infused risk reduction, harm reduction, and STD, HIV, STD testing.